Hi, and welcome to a presentation on what is intellectual disability. My name is Yvonne, and I work in psychology here at Cheeverstown. I'm going to give you a really broad, general overview of disability, intellectual disability, what it looks like, where it comes from, and a few ideas about how to work best with persons who have disability. So, just to get a formal definition of what an intellectual disability is, so someone who has a diagnosis of an intellectual disability has significant limitations in both their intellectual functioning, so that means their understanding of things, and then also in their adaptive behavior. So that basically means their life skills and how they navigate those things that people do day to day. And that also includes social skills as well. So this disability, in order for it to fall under the definition of an intellectual disability, it originates before the person is an adult. You might be familiar with some of the reasons why someone might have an intellectual disability. There's someone can develop an intellectual disability before they're even born, um, during birth, or afterwards. And I'll just go through a few reasons for that so that you get a sense of it if you don't already. So, from genetics, so chromosomal defects can cause an intellectual disability, um, and then different problems that a mother can have in terms of deficiencies and infections during the birth, and then any toxic exposure, so exposure to something like alcohol in huge amounts that would be toxic to a baby. So those are reasons why before the baby is born, why they might have developed an intellectual disability. And there's also some reasons why during birth, a person might go on, the baby might go on to develop an intellectual disability. So, infections that can happen then, or trauma during birth. So, something major happens within the birth where maybe the baby is deprived of oxygen. So, there might be some reasons then why after birth a person might develop an intellectual disability. And it's usually from some kind of head injury caused by maybe a car accident or a significant fall. And that might put them into the category of having an intellectual disability, even though they were born without one. So, how do we know if someone has an intellectual disability? So, it might be something that's spotted by a medic in hospital or on checkups. Maybe if a baby isn't hitting the milestones that they have, or if they've identified a genetic component, or if maybe the parents of the child are noticing that something isn't quite right. Or maybe when they go to school, a teacher might notice that they might be kind of different than other children their age. So it's usually noticed by someone, and then they would be referred to psychology, where we would do a couple of tests with the person to determine if it might be an intellectual disability. So, the things that we do, we look at both the person's IQ, so their intelligence, we also look at the adaptive functioning. So it's really important that we have the both of those results to know whether a person has an intellectual disability or not. So the adaptive functioning, like I mentioned earlier, has to do with how they manage day-to-day tasks that are appropriate for their age, depending on what age they are, and there's certain measurements that can look at that. So tasks maybe around the house or in terms of their own self-care, or socially how they're getting on. A few areas in terms of the social skills in the adaptive functioning where we would expect someone with disability to have problems with include their interpersonal skills, so how they manage getting on with other people, and their sense of social responsibility, and that could mean how they have a reciprocal, so a back and forth with people. So, someone with an intellectual disability might not really understand the interactions that you have with people to get along with others. They might have really low self esteem, and someone with an intellectual disability can be really naive or gullible to what someone is telling them, much more so than someone their age who is typically developing. And this is really important because this makes someone quite vulnerable to someone who mightn't have good intentions. So, other things like problem solving and rules might be difficulties that someone with a disability would have. Another area in terms of adaptive functioning would be the practical skills day to day that someone with an intellectual disability might have trouble with. And this can vary depending on their age in terms of what would be expected of them. But some of the difficulties that people into adulthood could face would be basic things like knowing if they cut themselves to either ask for a band-aid or to put one on. Could be how to navigate crossing the road or going for a bus. It could be to know when to go to bed or when to get up. It could be washing and cleaning and understanding money, and then also maybe communicating with others or even knowing how to communicate if there's an emergency or something wrong. So, to varying different degrees, these are some of the practical skills that um, someone with a disability might struggle with compared to their peers. Another area that we might be aware of in terms of the adaptive functioning of someone with an intellectual disability is their conceptual skills. So that means how they figure things out. So that might be quite different to other people their own age. And that could be things from language and figuring out how to use words to express themselves. It could be understanding money, time, or dates, or just basic numbers and quantities of things, and how to manage themselves. So, if you've worked with people with intellectual disability before, you'll have noticed that there's a huge variation in the levels of how severely their intellectual disability impacts them. And we can understand that in terms of the three different areas that we've just looked at: conceptual, social, and practical skills in terms of their adaptive behaviour. So we would use their abilities and what they're doing at the moment to assess which range that they fall into. So we'd use information on these areas to assess down the left there whether they're mild, moderate, severe, and profound. So, in the mild category, someone with an intellectual disability, they might be very capable of doing things day to day, and it might be quite subtle or even hidden how where their difficulties are. So, they might have problems with academics and problem solving, and they might seem a bit younger than they are. They might have problems with understanding their emotions and managing them for themselves, and they might where it might be quite difficult for them would be understanding other people's intentions and making those judgments. So it might leave them quite vulnerable to being exploited by other people because they might not have that bit about understanding other people. And then practically, they might need help with maybe seeking out health care or navigating a legal system. So, higher level stuff they might need help with, but they might be very much okay day to day with other things. And Typically, someone with a mild intellectual disability will be able to live reasonably independently. They might need someone to check in on them, but many people with mild disabilities can actually live completely independently on their own with just some supports in place for them. Someone with a moderate intellectual disability might have a much more striking difficulty with conceptual skills. So, that bit about figuring things out, and they might find it much harder to do any academics or engage in schoolwork. And they'll have a much more significant difficulty with social and communication skills, and their social judgment would be quite poor. And they might be able to care for their basic needs, maybe in terms of letting you know if they're hungry or if they need to go to the toilet, but they'll usually need help with most jobs, and they'll usually need to live with someone else. They probably would need support at least during the day. Someone with a severe intellectual disability will usually have little or no understanding of reading or numbers, and that kind of abstract thinking, and would need a lot of help around figuring those things out. So, even in terms of money or knowing where they were going, they might need a lot of help. And they often won't actually have that many words to use, and they might really only understand single words on their own or noises or phrases, and they would need support for everything within their life. They'll usually be living somewhere with kind of round the clock support. So someone with a profound intellectual disability will have very little ability to figure things out and will usually only interact through the physical world. Might not even be able to understand words from other people, and are usually totally non-verbal themselves and completely dependent on other people for everything to do with life. So, an important thing to consider when you're hearing all of these different categories of intellectual disability and labels, there can be a lot of information, but two really practical things to think about when you're working with someone who has an ID is what is their expressive ability and what is their receptive ability. And you can usually figure this out by maybe asking someone who is familiar with working with them, or maybe checking their file, or you can even contact psychology to figure that out. But this can be really important because there can be actually a difference between the two, especially for someone in the mild or moderate range. So that's important because someone might have maybe quite a high expressive ability but a slightly lower receptive ability. And that means that they might be able to act and talk and express themselves in a way that seems like they understand a lot, but actually they're receptive. So, what they're taking in from other people in their environment might be a bit lower. So that's really important because if you're working with someone like that, you might be treating them like they're understanding loads and loads because of how they act, but actually maybe they don't, and that could cause difficulties for you working with them, or it could cause difficulties for them. They might get really frustrated. And then another thing to consider is if maybe someone's receptive ability is quite high and their expressive is much lower. So they might actually understand a lot more than it seems. So they might be able to take in a lot of what's going on, but their ability to express themselves might be a bit lower. So that's important again because you might be treating them like they don't understand much and giving them loads of support, whereas actually they might understand an awful lot. So these are just things to consider. I think that that's one of the most important things when you're working with someone. So there are a good few difficulties that come about in someone's life because of having a difficult disability that are nearly in addition to the disability itself, that they're just a little bit more vulnerable to. And it's important to consider these because these could impact on how they're being, and it's just really important to be mindful of when you're navigating a relationship or working with someone who has an intellectual disability. So, the first thing to consider is that the person may have attachment difficulties. So, an attachment is the bond that a person has with an early caregiver, and it kind of forms the blueprint of relationships that they have later in their life. And everyone is vulnerable to having attachment difficulties through various different things that happen in life, and most people are born to imperfect parents, so it's not that uncommon in the typical population either. But certainly, someone with a disability is a bit more vulnerable. There's just a higher chance that there's been difficulties in that relationship. Um, and that can be because the parent was maybe going through a hard time um, around the time that the child was born, because of all the difficulties associated with navigating a world um, with a child with a disability. And it could also be that it was just a bit more difficult to bond with the child because of the nature of their disability. Maybe they had trouble expressing themselves, or maybe they had trouble understanding the mother. And those types of things can just make someone a little bit more vulnerable to attachment difficulties. And this is important to consider in terms of the relationship then that you have with the person. So even though that was a long time ago that may have happened, they might be just a little bit more sensitive in relationships that they have later in life. So someone with a disability is hugely more vulnerable to all different types of abuse, and you've probably heard about these in presentations by social work, but there is a number of different types of abuse: institutional, sexual, financial, physical, and emotional abuse. And the main reason that someone with a disability is a bit more vulnerable to that is they're kind of used to having blurred boundaries. So they're kind of used to people needing a bit more help from people, and not having those firmer boundaries that someone who doesn't have a disability has. And also, there's just that little bit of maybe naivety there that they have in terms of understanding what's wrong and right. So that's really important to be mindful of and to keep an eye out for when you're working with someone with an ID. Another difficulty that someone with a disability might have to face is a really high staff turnover, as people kind of come and go from different houses or different jobs or different caring roles. And just bearing in mind how that might be for someone with a disability who's maybe formed a good relationship with people, and it's a natural progression that this will happen, but for this to happen over and over again while someone is working with someone can really impact on that. And I'm going to talk a little bit about endings towards the end of the presentation. And it's just really important, I think, as a staff member, to do your best to end well, because it's inevitable that the ending will come. But if you can really focus on ending well and you can get loads of support to make sure you end well, then it doesn't have to be such a negative experience with someone, or for someone rather. To some degree or another, someone with an intellectual disability will find the world a confusing and maybe overwhelming place that they might have a lot of trouble making sense of. And I'm sure most people have had that experience of something not making sense, or being really frustrated by not being able to figure something out. And someone with an intellectual disability, to a varying degrees depending on maybe their ability or how their world is, might experience this all the time. Usually, most people with an intellectual disability are dependent in some way on other people, whether that be to a smaller extent to help them if they've got a mild disability, or to a much greater extent if that disability is severe or profound. So that's quite a hard feeling, to be kind of at the mercy of other people. And it's important to be mindful of that while you're working with them. That things like, I know in the manual handling training, it's really important not to just push someone's wheelchair without asking them or letting them know what they're going to do, because I don't think it's a nice feeling for most people to be um, totally dependent on other people and not feel any sense of control within that. So it's important wherever possible to give someone a sense that they have a little bit of control or autonomy over what they're going to do. And you can ask psychology or speech and language therapy or physio on the MDT to maybe help you to give the person more choice in their life, depending on their level of communication. Um, and then just really to bear in mind, and it's quite an uncomfortable thing to consider, but people with disabilities are often perceived as being different in a way that's not okay. So all sorts of different diversity has come to the mainstream in recent years, where now it's okay to be different in loads of different types of ways. And that's obviously amazing for society that we've made such progress on that. But unfortunately, disability hasn't progressed in this way. And um, there's still a huge stigma around it in society. And it's quite a sad thing to consider, but it's important to bear in mind that someone with a disability might have grown up in the feeling this way and might still feel this way, and to have empathy and compassion towards those feelings. So all of these experiences, everything I've listed out here, is really important, because these things together can just make someone more vulnerable to experiencing trauma. So these things, either big or small or all together, can lead to trauma for the person with an intellectual disability. And that can come about in and manifest itself in various different ways that I'll touch on briefly. But just to bear in mind that the person is likely to have had some form of small or bigger trauma in their life, as well as the intellectual disability. Just to go back to the wider context, it's really important to bear in mind that the family probably suffered some kind of feeling of loss. And not all people suffer loss, and that can be an experience for some and not for others. But it may have been that the family really had a huge adjustment period in terms of having someone in their family with an intellectual disability, and this might have impacted on the person with an ID. And it's just important to keep in mind that things might be a little bit difficult, or may have been a little bit difficult for them growing up, and that can just leave them a little bit more vulnerable to different kind of mental health difficulties and difficulties in their relationships. So a lot of research has gone into the concept of a secondary disability. So we've spoken a little bit about the primary disability that a person has in terms of the neurological damage that they've experienced, either before they were born or after they were born. And it's really important that we also consider the secondary disability that a person has. So that's the blocking out of intelligence that's not caused by the primary handicap, as a defense against the trauma that's happened to them. So the different things that we've just discussed there that may have happened to them in their life, and different painful emotions that they've experienced. And there's two main ways that they can manifest in terms of the person with an intellectual disability, and they can be acting out behaviour, so maybe aggression or behavioural problems, or it could be complete withdrawal from interacting at all. So if we think a little bit about what happens when someone's had a trauma, so there's loads of different types of traumas that people can experience through life. But usually if someone's had a trauma, especially after a big incident, they might be a bit shell-shocked, and they might find it hard to think or feel a bit numb. And this can also happen over a long period of time after other emotional traumas or one of the other traumas that we've just talked about. And that can be really disabling to the person with a disability, on top of the disability that they have. The emotional impact of all this, and thinking about as well the impact of being more like other people from a different tribe than your own family. So, a person with Down syndrome, for example, might look more like other people than people in their own family. So, there's just so many different ways that someone can be impacted by this. It's not really black and white, but it's really important when we're considering different difficulties that a person with a disability is facing. Another thing to consider is the massive dependence on others that a person with a disability has due to being vulnerable. And this can result in them really learning to please others as a way of coping. So they might be really pleasing and they might always be smiling, but it's important to remember that that might not be their true feelings, and this could cause them to be maybe frustrated over time. So it's really important to notice that and to try your best to maybe try to figure out how the person is truly feeling at the time. So, different experiences aside from the emotional difficulties that a person with a disability is likely to experience are they might have low socioeconomic status and they might be more in poverty. They might have a lot less social supports because of their disability and more limited friendships and more limited integration in the community. And this has gotten a lot better in recent years in Ireland, but the person with a disability generally doesn't have the exact same amount of opportunity as someone else. And carrying an awful lot of the unwanted projections of society and really limited opportunities. And again, this is getting a bit better, but traditionally, people with disabilities might have only had set roles or set jobs that they could do, and it mightn't be as meaningful as the opportunity for someone without a disability. And this is changing and integration is happening, but it's really important to bear in mind that a person might have had a lot of these challenges. And this is all important because when someone with a disability has different behavioural difficulties or acting out, um, it's usually important to consider that each of these might have their own meaning. So there might be a specific reason for this. And these are all really difficult things to consider. And sometimes we can, as staff, maybe not want to consider that these different difficulties that they've had in life, but it's really important so we don't just put things down to them having a disability or them just being bold. It's really important to understand that there might be really complex reasons behind this, and then that's important in how we treat the behaviour of someone and kind of get the meaning behind it. But it's a really difficult thing to have to realise all this suffering that someone has gone through for staff working with people who have disabilities. So, having this awareness about different difficulties that people face is important because you're likely to feel a few different emotions when you're working with someone with a disability. And this is all backed up by a lot of research. So, this is really based on science. But we know that people can have a real strong tendency for guilt and sadness about not being able to fix the disability in the person, or because maybe the person with an ID doesn't have the same opportunities that they have. And this can cause someone working with a disability to really overprotect or over shelter a person from facing difficult emotions as a result of having the disability. So you can nearly find yourself taking on a bit of a parenting role and maybe losing your own boundaries at work. And you might find yourself, some people can find themselves becoming really polarized in 1 minute really overestimating their own ability and then feeling completely useless another minute. Um, so that can be a really common one that people experience, and feeling really uncertain as well is a huge one, because when you think about it, a lot of the work that you're doing with someone with a disability, no matter how well you know them, there's going to be an element of uncertainty there. So you're always thinking, does this person understand me? I wonder why they're doing this, or am I doing this right for them? Why do some things work and not others, or some things work sometimes and not other times? So it's natural then, when you think about it, that you would feel unsure or uncertain in your work a lot of the time. And you might find yourself, because of the difficulties with boundaries there, and the difficulties that a person with disability has on depending on others, you might find yourself really with work becoming your life and a big part of your identity. And these are just all really important to notice, because these could really impact on you and your ability to sustain yourself in the work. And it's totally normal to experience all these things, there's nothing wrong with it, but it's really important to notice if that's happening for you, and maybe check in with someone, whether it be through staff support or your peers, and maybe to ask them, if they're feeling this way as well, and just to notice that coming up, so then you can have a chance at managing it a bit better, and managing your own self-care a little bit better in the job. So just a brief overview then of how intellectual disability has been viewed in Ireland. It's important for us to know that, and it's also important for us to consider when you might get a bit sad or frustrated with how disability is, people with disabilities are treated at the moment. We have come a long way from how it was back in the last century, and we've obviously an awful lot more way to go, but just a brief overview. So in the 1950s, there were very few special services to support people with an ID, and then Stewart's Hospital had been established in 1869, and that was there, but the next service to open was St. Vincent's in Cabra in the 20s. And then from the 1960s onward, there were a lot more specialist residential and day services that were developed across Ireland. In the 50s, there was a nurse training program was developed, so specialising in intellectual disability, and so those cohort of people would have been trained specifically to work within disabilities. In the 1990s, then we had a move towards the needs and abilities, so the development of policy around a person with a disability. And then most people will have heard of the Special Olympics, which started in 2003. And then we have the Disabilities Act in 2005. And then next we have Time to Move On, and then the New Directions in Disabilities. So an awful lot of progress has been made in recent years in terms of policy development and empowering people with disabilities, and considering rights. So we have come a long way from being just reliant on institutions and specialised services, and there's been a huge shift to move people with disabilities out into the community and integrate them with society, rather than keeping them away in an institution. But we still have a long way to go with this, and hopefully there'll be huge progress in this area in the next 20 or 30 years. So when we're hearing all about the differences between people who have disability and who don't, it's really important to bear in mind that someone with a disability has the exact same emotional world as someone who doesn't have a disability, and the exact same capacity for happiness, sadness, frustration and anger, and that's where the similarities really are. And it's good to bear this in mind when you're working with someone who has a disability, that is intact. So some really practical tips here in terms of starting out in working with someone with a disability. So they may not feel comfortable, they may or may not feel comfortable in terms of giving a handshake, but a smile and a warm facial expressions and saying hello is always appropriate for any level of someone with an intellectual disability. It's really important that you speak to the person and not just the person who's with them or their caregiver, because it really doesn't matter what level of disability that a person has, they will notice this and appreciate it if you really acknowledge them and treat them like a person, and to also treat them as an adult. Oftentimes someone with a disability even if they're in their 20s or 30s, can be treated in a really childlike way. And that's not really appropriate for someone who actually is an adult, and they might need a lot of support, but at the end of the day, they've developed through childhood the same as everyone else, and they deserve to be spoken to like an adult. So being patient and listening to the person is really important. And don't pretend to understand or not listen to them. I'm sure most people have had that experience where someone's not really listening to them, and someone with an ID can have that as well. If you kind of, and it can come from a place of not wanting to offend them by asking them, but it's more important that you have that connection in understanding what they're saying rather than asking the inconvenience of asking them. And it's really useful if you don't understand them. Maybe you could have someone there who knows them really well and is really used to how they speak, and they might be able to help you. But that bit of understanding and connection is important. And it's okay to use common expressions and talk to them like anyone else, and to make a joke and have a sense of humour and actually get enjoyment out of the interaction. If you're feeling like you're relaxed and enjoying it, then the chances are that they will too. So all that is fine and appreciated on both sides. So we spoke a good bit about the different traumas that a person with a disability may have experienced. And just in general, like, a lot of people really benefit from feeling safe and secure. And there's a few different ways you can do that that are important for someone who's had trauma, maybe in one of the ways that we talked about, or even someone who hasn't, who has a disability. Um, so a few different ideas of how you can do that is to promote physical safety of the individual where it might be lacking, so to help them feel safe in their home environment, and to also promote emotional security in the person by minimizing any experience of anger or rejection or not being available for them when you're working with them in that environment, and just doing your best to focus on that. And you can usually get a bit of help with that, either by staff who know the person really well, or a caregiver who does, or you can ask psychology for help on how to do that as well. But it's the really basic things. It doesn't need to be anything too fancy. Generally, with everyone, a warmth and kind of acceptance and understanding and having empathy towards them, being able to put yourself in their shoes, can be huge. It can be more important than anything more nuanced. And a really good one that both you'll enjoy as the person who's with the person and that they'll enjoy as well is finding a way to engage, to have that mutual connection through joint activities. And they can be a task, or it can be just something that they enjoy, and kind of connecting with them on that level is hugely beneficial and gives that real sense of shared fun and joy. That's you can't have it all the time. Life doesn't work that way for everyone, but if you can find ways to bring that into your day, it'll make the person feel more secure, and you'll also get more of a sense of achievement in your job. So new learning together is a really big one, and it's when you can, in an enjoyable way, and ask for help. Ask for help from management or from the MDT, the multidisciplinary team, who are usually available to contact for the person, as ideas to get ideas around what support you might need to do this. So we need to really ground ourselves in the rights that we've established for people with intellectual disabilities. So people with intellectual disabilities are, before any label or anything else, they are people, they are human beings, and they are equally as valuable as everyone else in society, and should not be disadvantaged because of their disability. People with intellectual disabilities belong in the community with everyone else, and they belong living and working alongside people who don't have disabilities, and they have the same rights of citizenship as any other person. A person with an intellectual disability is fully entitled to a chance to live the same decent life that other citizens would wish for themselves, and not a really restrictive, reduced version of that. So it's really a worthwhile endeavour for our community to spend time, effort, and develop the resources so that people with an ID can have the equal chance for a decent life in according to what they would want. So, just one really specific note on bereavement, especially during the different difficulties that society is facing at the moment. It's really important to be aware of how a person with an intellectual disability experiences bereavement and how you work with them with that. So, firstly, to say that we know from research that people with ID are so aware of losses. And it would make sense if they've had to deal with loss throughout their life, be it through staff turnover or maybe having to move out of home, and different changes that have happened to them. So there's no difference in how someone with an ID will experience the emotional feeling of loss than how someone with a typical IQ will experience that emotional feeling. It's that piece about the emotional world being quite intact. And sometimes, unfortunately, people with an intellectual disability are excluded from different bereavement rituals because people are scared that they can't cope, and um, worried about them. But actually, it can be helpful for them to be involved in different rituals and different processes to help them process the emotion the way that anyone else would. And that might need to be adapted, and they might need extra help around that. But it's really important to acknowledge that they will have the same feelings usually. And you can get support about how to manage this from the multidisciplinary team. And you can contact me to set that up if you feel like it's something that you're worried about with the person and you want to do a good job with. It's always useful to get support with that. So I'd spoken a little bit earlier about the importance of endings. For loads of different reasons, from the attachment relationship to the high turnover of staff and different experiences of loss. It's important for everyone, but it's really important for when you're working with someone with an ID to end well. So endings can be hard because they can bring up things for the person with an intellectual disability if they've had bad experiences of endings before. Maybe they've had a really good relationship with someone for years and then they just left. And it can also bring up things for you as a staff member. Maybe if you had your own different difficulties with endings or loss in your life, you can maybe want to avoid that, and it's totally natural to feel that way. And especially ones that are emotional where you've had a really close relationship. But it's really important to end well. And again, you can get a lot of support around this, and it will leave the person that you're working with and you with a better feeling about the relationship and the ending if it's done well. And this can be through a celebration, saying goodbye in a proper way, and maybe marking the positive things that you've done together. But again, don't be afraid to ask for help around these things because they can be tough to come up with on your own, how to do it. But just to be mindful of them, that they are important, because you'll be important to the person if you're working with them in a way that people in your own life are important to you. So just to keep that in mind. So I hope that that's given you an overview of working with a person with an intellectual disability. If you're worried about it, or if you're worried that you won't be able to manage working, or you're having difficulties managing a particular thing in working with someone with an ID, if you have an ending coming up, or someone's been bereaved, or you yourself feel a bit overwhelmed, or you've really identified with those feelings of being unable to manage, remember that that is a normal part of the work, and just seek supervision, seek out help and support to manage that. You won't be judged for it. It's a positive thing to ask for a bit of help around that. So don't be afraid to, you have my email at the bottom there, or contact the MDT. Thank you so much for listening, and thanks for the really important work that you're doing in our community. And my contact details are there if you want to get in touch or have any questions.